Can we talk about arthritis? Because you said you kind of started in your career there.
Did a lot of arthritis.
Yeah. Where are people experiencing that the most?
Okay, so I would say the most would be knee, hip, back, so arthritis of the spine. I would say those would be, it's usually the areas where a replacement might be indicated, like a knee replacement, a hip replacement. Yeah, I would say knee and hip would probably be the highest.
Yeah. And what would, I'd be curious to know what people can do on their own to help with that, and then after that, what you can do that they can't do and that conventional medicine might not do.
Absolutely. So I'm a big proponent of home care because with arthritis, it's something that needs to be managed, not cured, right? The therapies I offer just jumpstart the treatment. A lot happens at home. So, you know, basic stuff. If it's an acute flare, you rice it, right? You elevate it, you put ice on it, compress it. If it's sort of more in a chronic state, that's when you can apply heat. So I counsel the client into applying hot compresses, heat therapy. I work a lot with physiotherapists, so I'm a big proponent of that as well. Stretching, low impact exercise. You know, if the treadmill's too much, go join a pool, or you have a friend's pool, do some exercise in the pool, so that kind of thing. Then we'll even get into some of the creams that they can be using. If it's really an acute state and a lot of pain, you know, I'm not one of these naturopaths that's completely opposed to anything pharmaceutical. I'll say, you know, try Voltaren, you know, a topical anti-inflammatory. But what I'll do is I usually half the dose and then split it between doing something like a Traumeel gel, like a homeopathic. So you get the best of both worlds. Over and above that, I always like an arthritis client to be on some sort of anti-inflammatory supplement or diet. So I'll teach them about anti-inflammatory diet. There's a few that I like to use, and I'll also suggest some sort of anti-inflammatory supplement, whether it be a curcumin based or whatever. The thing with those is they're very personal. Like I find you sometimes have to try a few, and a patient will respond to one rather than another. So it's a little bit of hit and miss with those, but as long as you give a good amount of trial, you'll find one that will work for you.
Okay. What's been your experience with treating this? Are you quite successful?
Yeah. The only issue is that I used to do a therapy called mesotherapy, which unfortunately we can't really do anymore. And I was very successful with that. I've replaced that for the most part because I used to pair up the mesotherapy, which is an anti-inflammatory injection. We're still trying to get that back onto our scope. Pair it up with acupuncture. And that combo, I did actually a clinical trial for a company that made the mesotherapy product. And so I kept perfect records and everything. And we were just seeing dramatic results within 6 treatments. Yeah, it was very successful. The acupuncture, you know what? You can get just almost the same. I would say that as opposed to in 6 treatments, it might take 10 treatments. That's the only difference I would find with that.
Okay.
So yeah, I would say again, going back to what I said earlier, you know, give me so many treatments. You're either going to be very happy, or you're going to say, oh, you know what, it's not really working, and in that case, we'll switch our therapy to something else.
Okay.
But yeah, good success with arthritis.
Okay.